afternoon, Mr. Chair, members of the board, Dr. Casey. It's a pleasure to be with you again this month as we go forward and give our monthly COVID update. Okay. Are we ready? All right, very good. So as in the past, we are going to have my two other colleagues join me in just a few minutes regarding the VDH Chesterfield Health District. We have Dr. Samuel that'll be with us, and then Fire EMS County Government Update will be given by our Chief Center. One of the things we are very excited about since the last time we met is the launch of our COVID text notification. I want to thank Jess Robinson in Chesterfield Emergency Management for helping with this initiative to get it up off the ground. So very quickly, it's easy to do. You got your cell phone with you, whether you're at home or right here in the boardroom, take it out. And all you have to do to sign up for text notification from the for VDH or from Chesterfield County, all you have to do is to text capital C, field, and then COVID to 888-777, as simple as that. Again, you just text C field COVID to 888-777, and within about 5 seconds, you're going to get a response back telling you that you are now registered. And you can unregister yourself at any time, and this information does not collect any personal data on you. So you can, again, unsubscribe at any time to opt out of this new initiative. So we're very grateful that, again, to our community, another way that we are trying to communicate information to our citizens. As we move along, last month I had the opportunity to talk to you about access on demand, another way that we are providing access for folks to get to COVID appointments to get that vaccine, right? And so this month I come back to you with another opportunity, thanks to our great partners at United Way of Greater Richmond and Petersburg, while partnering with Lyft. And Lyft will give you a free ride. Yes, a free ride. This is the opportunity. Again, take out your cell phone. All you have to do is to make sure you have that Lyft app on your phone, and also be 18 years old or older. And if you are not 18, get with someone that is 18, a parent or guardian, and they will take you to receive your free COVID vaccination at one of the partner agencies. And so, again, if you are maybe not as technical savvy, I am 100% certain, as our library professionals have done in the past, throughout this whole process, we'll be happy to help you at any of our branches and locations. So take advantage of that as well. These next few slides are going to show adjustments already made or soon to be made to the county's COVID protocols by Scott Zaremba and the community operations team as the county begins the long journey back to what we call, hopefully, the new normal. That being said, one of the things right off the bat you'll be able to see is accepting cash payments will be an option at the convenience centers around the county. Scaling back outside signage by 2/3. So in other words, one sign is going to cover a lot of different points and not so many signage around the campuses. Curtailing additional plexiglass barriers, installation, only repairing existing plexiglass or barriers that exist, so no new barriers will be going up. Scaling back, that second touch point cleaning is going to happen. So the only cleaning that's going to happen is what is regulated according to risk management guidance as well. And then you will also start to notice replacement of pamphlets, printed materials in public locations like the libraries and recreation centers and lobbies and so forth. Now, this is exciting for our library lovers, and you've been maybe perhaps waiting on a book to come in, and you didn't want to necessarily wait that 72 hours for it to be cleaned. Well, reduce the 72-hour hold time on returned library books, and now you only have to wait 24 hours before it can be retouched and reshelved back for our library users. So I know my daughter is going to jump for joy for that. Moving right along, a few other updates that may be of interest. As it relates to allowing transportation by van, our summer camp groups and kids will be able to attend summer camps and participate through transportation on van usage. Increase use of schools for recreation and sports leagues is an opportunity now. Reopening of player benches and bleachers for the public use, that is an opportunity now. Fields have been reopened throughout the park system, and I can attest to that. I was at a ball game last night. Park and Recreation to hold the 4th of July celebration. We're looking forward to that as well. Reopen Rockwood Nature Center and Community Recreation Centers. Resuming rentals of space at recreation centers and fairgrounds. And once the fairgrounds closes doors for the vaccination sites, they will be back to continuing use. So I know that upcoming events there, such as the July 4th celebration, and hopefully this year the county fair will be back. Class participation for recreation programs currently at 50%. Effective June 1, the Parks and Recreation Department plans to move that to max capacity of participants at 100%. Opening of historical sites, including special events through the Historical Society, is also on the horizon. And just a few other updates. Staff will be eliminating extra safety requirements for opening office mail, so you don't have to use gloves anymore. And also, our mental health support services are bringing back more of their employees to be able to have on-site clinical in-person services as well. Did you know that heroes work here? Well, I'm glad you know now. Heroes work for Chesterfield County. And let me tell you a little bit about these heroes. What we have learned over the past 14 months is that our workforce is resourceful and resilient. Our dedicated employees never missed a beat in providing customer service to our citizens. While a large percentage of our employees moved to working remotely, response for services in many areas have enhanced because the services were being provided outside of traditional work hours. Employees needed flexibility in their workday because family responsibilities, which also benefit many of our customers. As organizations are now beginning to roll out plans for returning employees to their work sites, the county is doing the same. What we have learned is that the way we left the workplace in March 2020 will probably not be the same way we return over the next few months. Employees have proven across various industries that many of our jobs can be performed remotely as well as on-site. So, what is the county doing to prepare for the future of the workplace? Again, I'm glad you asked. Let me tell you about that. Exploring work models such as the hybrid and on-site only model. Like most employers, we are exploring a blend of both remote and on-site work models to determine the best option to meet the needs of customers and employees. Decisions are being made based on systemic methods for leaders. HR has developed a decision-making tool that leaders will use to objectively assess whether a job can be performed remotely, part of the time, or must be done on-site only. This process will begin later this week, so more information to come. Ongoing vaccination clinics. Employee Medical Center will continue to educate and vaccinate government and school workers. Our Employee Medical Center has done a fabulous job of educating our workforce about the benefits of the vaccine and making it available for both county and school employees. This will remain an ongoing initiative. Now, we recognize also that accommodations sometimes have to be made. As appropriate for customers and employees, in certain instances, when customers and employees need special accommodations, we will put measures in place that will help in reducing risk and exposure to the virus. And in regards to flexibility and patience, adjustments will also be needed. At the onset of the pandemic, we had to be flexible as we put measures in place to provide county services while also protecting both the customer and the employee. So, as we put our best foot forward and solidify our new work models, we ask for patience as we continue to adjust to our new normal. And lastly, in this area regarding customer service, as dedicated public servants, customer service will remain our first priority. Our goal is to finalize our plans and prepare for a July 1 phase implementation. Like last time, I provide you a slide known as chesterfield.gov/COVID, where you and members of the community can go and find opportunities to register for an appointment to get your free COVID vaccine. So again, here's that information. And as I close out my portion, before we move to Dr. Samuel, don't have a slide for the next information, but I do want to use it as a service announcement for those that may have any students that may be returning to school this next academic school year, 2021-2022 school year, and you may be thinking about registering your child to be there in a virtual capacity. I recommend that you go to Chesterfield County Public Schools website and register them for online learning if that is your desire. That deadline to do so is June 1st. There's a registration process for that. Again, go to the Chesterfield County Public Schools website. It is on their homepage as a link. June 1st is a deadline for a registration process if that is your desire to have your child what is known as the Virtual Academy for 2021. That is K through 8. K through 8. Those that are seeking perhaps online options for high school, you have also an opportunity for what is called CCPS Online. This is another option for secondary students. The deadline to register for high school in an online environment is July 9th, also located at the Chesterfield Public Schools website on their homepage.